the cancer's all gone, but actually it's lurking in the lungs and the bones and the brain. It's just too small to detect at that time, and it continues doubling, we call it, growing, the doubling process, and then it shows its ugly head a few months later. So it's not like it's in remission or somehow it's cured and it comes back. There's nothing that's changed. You've just dealt with, say, the breast, a local part, and there's still disease growing throughout the body untouched by the present therapies.
There is no toxin or combination of toxins that can kill all cancer cells. Only the troops on the ground can do that. Even in those few cases where chemo is somewhat effective in the short term, it greatly raises the chances of secondary cancers and other fatal diseases in the long term. The drugs used to treat cancer are some of the most toxic substances ever designed to be used on the human body. Chemotherapy devastates the immune system so much that cancer patients have died of the common cold. If an IV bag is spilled, it's classified as a major biohazard. Yet we inject this into our bodies and expect to be cured. In survey after survey, the overwhelming majority of oncologists have stated they would never take chemotherapy if they had cancer, or administer it to their families. And yet, the FDA has deemed these incredibly toxic drugs to be safe and effective, despite the fact that a common side effect is death.
There's no legitimate doctor today that will not tell you that chemotherapy and radiation destroys the body and destroys the immune system.
She went in operation on Monday. They shocked her with chemotherapy. 2 weeks later, she was dead. And they said that she had an overreaction to chemotherapy. What the hell was that overreaction to chemotherapy? I mean, you know, people have different sensitivities to things. Why are they giving a crap in the first place? Why aren't they talking about that? But you know, she's now a patient. She's fearful. She's a very vulnerable person at this point in time. Really depressed and distressed of everything, and she's now just she's just a pawn of the system.
Here are a few of the side effects of radiation and chemotherapy treatments. If our standard treatments are ineffective against our major cancers, why do 60% of all patients receive radiation treatments? Why do 67% get surgery? And why do 80% of all cancer patients receive chemotherapy? How can the cancer industry get away with using such ineffective treatments when the results are pathetic and in almost all cases far less than what you would expect with a sugar pill? They get away with this because, 1, conventional treatments are the only game in town, and 2, because there are massive sums of money at stake for the medical, pharmaceutical, and financial industries, which profit greatly from using treatments that do not work. You might be thinking, but I've read in newspapers that we're making gains against cancer. What you read is part of a phony good news campaign the cancer industry relies on for continued public funding. Here is how this campaign was described back in 1987. As a rule, the good news comes as an announcement that the 5-year survival rate for one or another form of cancer has increased. Here's a typical headline that was carried in every newspaper in the U.S. The number of cancer survivors has tripled. The chances of surviving for 5 years has soared. This gives the impression we are actually winning the war on cancer. Magically, the cancer industry has created good news from bad. Unfortunately, they're not talking about long-term survival rates, but just 5-year survival rates. In fact, the cancer industry has adopted a rather peculiar definition of a cure. Normally, a cure is defined as the elimination of a disease. In the case of cancer, a cure simply means you're still breathing 5 years after diagnosis. In fact, a cancer cure does not mean the disease has been cured at all. At the end of the 5th year, you could still have cancer, and if you're still breathing, you've been officially cured. Of course, if you die of cancer in the 6th year, you will be officially cured of cancer and dead of it at the same time. No other disease in the history of the world has had such an Alice in Wonderland definition of a cure. You can live 5 years with AIDS, yet no one will claim you're cured of AIDS. You can live 5 years with heart disease, but not a single health institution will say you've been cured of it. But if you live for 5 years with cancer, you're cured, whether you agree or not. Why then is such an absurd definition used with cancer? Because it's the only way to create the illusion we're making progress in the war against cancer.
If you had breast cancer in 1930 and you have breast cancer today, your prognosis is pretty much the same. Nothing has really changed.
Early detection is the main device the cancer industry uses to deceptively raise cure rates. When the cancer industry says that early diagnosis means you have a better chance of being cured, all they are saying is that you have a better chance of breathing another 5 years. Not because of treatments or because you're living longer, but because the diagnosis was done earlier. Suppose you have a man who died of cancer at the age of 70. If he was diagnosed at age 67, he would not be cured because he had only 3 years left in his life. But if he was diagnosed at age 64, he would have been cured because he would live for 5 years with the cancer before he died of it. Early detection makes it appear as if somehow the treatment is making people live longer, when in fact they are not living longer. When studies have compared treated and untreated patients, they show untreated patients actually live longer than treated patients, and obviously with a higher quality of life. Most people are shocked to learn that untreated patients live as long or longer than treated ones. But what would you expect from drugs that do great harm and give benefits no better than a sugar pill?
Well, we're dealing with the major cancers like colon, breast, prostate, lung, pancreas. There's, extremely little benefit from therapy. So certainly this is a point of view that should not be dismissed, that leaving cancer untreated may result in longer survival.
Untreated patients also respond much better to natural therapies than treated patients.
We get these terminally ill patients, if they're untreated, they respond a lot better. The body hasn't been poisoned with all the chemicals, and the bone marrow and the immune system and all the defenses haven't been poisoned or destroyed.
You'll never go into a conventional physician's office and have them tell you, well, listen, if you do nothing, you're actually going to live longer than if you get my treatments. They're just not going to say that. I can't tell you how many people have come in who now have a very large tumor, or it has now spread into their liver, and it was, let's say it started in their breast and now it's in their liver, and it's been 9 years, 10 years. And I said, what did you do? And they said, nothing, I just didn't want to do anything. Okay, well, that person would never have made it 9, 10 years. That person, most likely, if we look statistically at that person would have been dead probably way before 5 years. The people that refuse treatment at all come in much better condition than those that have gotten the treatment.
In other words, conventional treatments only make a bad situation worse. Thus, the cancer industry has deceptively increased short-term 5-year cure rates through early detection, but have not made the slightest dent in long-term survival rates. The one major cancer where mortality rates have fallen significantly is stomach cancer, yet early detection and treatment had nothing to do with that. It was the declining use of food preservatives and other dietary factors that led to this decline, not treatment. There are many other ways the cancer industry fools the public. Let's look at a few. Say there were 100 people involved in a clinical trial of a new chemotherapy drug. Out of the 100, you expect 2 people to get breast cancer. But during the trial, after all 100 people were put on the drug, only 1 person got breast cancer, meaning the reduction in breast cancer was 1 person out of 100. This is called the absolute benefit, 1 in 100, or 1%. This is not good news for the drug company because 1 in 100 could happen by chance. But remember, 2 people were expected to get breast cancer, and only 1 got it. And 1 divided by 2 equals a 50% reduction. Through the magic of number manipulation, this drug can all of a sudden reduce your chances of getting breast cancer by a whopping 50%. This is called the relative benefit. It magically turns the 1% absolute benefit into a 50% relative benefit. I call these rubber numbers. Of course, there are other problems. Even though this drug may have helped only 1 person, its side effects greatly raise the risk of developing secondary cancers and other diseases in all 100 people. In other words, everyone suffered harm from the drug, yet only 1 person may have been helped by the drug, and that could have been purely by chance. This was a hypothetical example. Here's one from the real world. A few years back, there were headline articles reporting a 49% decrease in the incidence of breast cancer in women who took tamoxifen for 5 years. In fact, the 49% benefit is a relative number. The absolute benefit was only 1.5%, far less than a sugar pill. Even worse, tamoxifen has many serious side effects, just one of them being liver and uterine cancer. The drug Herceptin has been described as amazing and unprecedented, a wonder drug. It's even been called a cure for breast cancer. Drug companies claimed that clinical trials showed a 46% decrease in recurring breast cancer. In fact, the absolute benefit was less than 1%. The only thing amazing about this drug was the public relations behind it. It was recently reported that a new drug produced a 23% improvement in survival for lung cancer patients. But if you look into the study, the 23% improvement